Now, Kevin Cirilli, let me bring up a quote from Michael Canon over at Cato. He will join us here in a bit. He's with the Cato Institute. He's supposed to agree with the Republicans. Forget about that. He is scathing. This bill is a train wreck waiting to happen. The House leadership retains the very Obamacare regulations, threatening to destroy the insurance markets and leave millions with no coverage. It merely applies a new coat of paint to a building that Republicans themselves have already condemned. Kevin, that's from their friends.
Yes, and I think Mr. Canon is reverberating and leading, I think, what other folks throughout the Washington think tank conservative institutions are also saying. Here's where it gets interesting. Here's an interesting point of nuance. Then candidate Trump was able to win over the grassroots conservative movement that many of these groups like Cato and Heritage, if you will, represent. Now, all of that said, these institutions themselves have always been apprehensive about then candidate Trump and now President Trump and whether or not he's conservative enough. And this, I think, again, is this first political referee. Everyone's waiting for the Congressional Budget Office to score this thing.
Kevin, I'm looking at some of the stories that we're writing, and we're talking about the U.S. coal output, whether President Trump can really bring jobs back there. What are the industries where he's kind of, he's vowed to bring jobs back and where he really will deliver, and which are the ones where it just won't be enough?
Well, Francine, this is the first legislative with health care, the first policy fight that he has to get to if he wants to get to tax reform, if he wants to get to other policy areas. With specific regards to coal, here's an interesting point. The progressive strategists that I talk with, the Democratic strategists that I talk with, they note that coal workers were a large portion of voters who backed then candidate Trump in order to get him into the White House. They're also going to be some of the first people to potentially lose health insurance as a result of these repeals on the Affordable Care Act.